Welcome to my channel today. Let's talk about vaginal odor. If you are new, kindly subscribe and turn on your notification button to receive update about new videos. Vaginal odor, a topic many women are curious about but often hesitate to discuss. Understanding what's normal and what's not when it comes to vaginal scent is crucial for maintaining good vaginal health. Every vagina has a natural odor, which can vary based on several factors. These factors include your menstrual cycle, hygiene practices, and overall health. While some odors are perfectly normal, others might signal an underlying issue. This essay will guide you through the different types of vaginal odors, their causes, and when it's essential to seek medical advice. The vagina has a delicate ecosystem. This ecosystem is influenced by various factors, including the presence of naturally occurring bacteria. These bacteria play a vital role in maintaining a healthy vaginal environment. As a result of these bacteria, a slight odor is expected and normal. The vagina's natural scent is typically mild and not unpleasant. It shouldn't be strong or foul-smelling. If you notice a sudden or drastic change in your vaginal odor, it's best to consult a healthcare professional to rule out any potential problems.
Vaginal pH plays a crucial role in determining its scent. The pH scale measures acidity and alkalinity, with a pH of 7 being neutral. The vagina's ideal pH level ranges from 3.5 to 4.5, which is slightly acidic. This acidic environment is maintained by lactobacilli, beneficial bacteria that live in the vagina. Lactobacilli produce lactic acid, which helps control the growth of other microorganisms. When the vaginal pH balance is disrupted, it can lead to changes in odor. Factors that can disrupt vaginal pH include douching, using harsh soaps, and even sexual intercourse. Maintaining a healthy vaginal pH is essential for preventing infections and maintaining a normal vaginal odor. One of the most common causes of an unusual vaginal odor is a forgotten tampon. It's more common than you might think and can happen to anyone who uses tampons. If you forget to remove a tampon, it can become a breeding ground for bacteria. As the tampon absorbs menstrual fluid, it creates a moist environment where bacteria can thrive. This bacterial overgrowth can lead to a foul, often described as rotten odor. If you experience a sudden, strong odor, especially after your period, it's crucial to check for a forgotten tampon. Don't hesitate to seek medical attention if you suspect you have a tampon lodged in your vagina, as attempting to remove it yourself could cause further complications. A healthcare professional can safely remove the tampon and address any potential infection. Section 5. Bacterial Vaginosis, when good bacteria go bad. Bacterial vaginosis, or BV, is a common vaginal infection. It occurs when there's an imbalance in the vagina's natural bacterial makeup. The vagina usually has a balance of good and bad bacteria. In BV, there's an overgrowth of certain types of bacteria, disrupting this balance. This imbalance can lead to a thin, grayish-white discharge and a distinct fishy odor. The fishy odor is particularly noticeable after sex or during menstruation. While BV is not a sexually transmitted infection, or STI, sexual activity can increase your risk. Other factors that can contribute to BV include douching, smoking, and using certain types of contraception. Treatment for BV typically involves antibiotics.
Section 6. Tricomoniasis, a parasite that can cause odor. Tricomoniasis, often called trick, is another common cause of vaginal odor. Unlike BV, trichomoniasis is a sexually transmitted infection or STI. It's caused by a single-celled parasite that can be passed from person to person through sexual contact. One of the telltale signs of trichomoniasis is a strong, foul odor, often described as fishy. Other symptoms include itching, burning, and painful urination. It's crucial to seek medical attention if you suspect you have trichomoniasis. Treatment typically involves antibiotics for both partners to prevent reinfection.
Section 7. Yeast infections, the cause of a yeasty smell. Yeast infections, also known as vaginal candidiasis, are incredibly common. These infections are caused by an overgrowth of candida, a type of fungus that naturally occurs in the vagina. A healthy vagina keeps candida levels in check, but certain factors can disrupt this balance. These factors include hormonal changes, weakened immune systems, and certain medications like antibiotics. Yeast infections are characterized by a thick, white, cottage cheese-like discharge and an intense itching sensation. A yeasty odor, often compared to the smell of bread or beer, is another hallmark symptom.
Section 8. Metallic odor blood, IUDs, and other causes. Experiencing a metallic odor from your vagina might seem alarming, but it's not always a cause for concern. The most common reason for a metallic scent is the presence of blood, especially during or after menstruation. Blood contains iron, which can leave behind a faint metallic smell. This is entirely normal and usually fades away within a few days. Another potential cause of a metallic odor is the use of certain intrauterine devices, or IUDs, as a form of contraception. Some IUDs, particularly those containing copper, can interact with vaginal fluids, resulting in a metallic scent. This is usually harmless and tends to diminish over time as your body adjusts to the IUD. However, it's essential to be aware of other, less common causes of a metallic vaginal odor. These can include, in rare cases, a metallic smell, especially when accompanied by unusual discharge, could indicate changes in the cervix. These changes might require medical attention. Similar to a forgotten tampon, other foreign objects lodged in the vagina can lead to a metallic odor alongside other symptoms like irritation and discharge.
Section 9. Earthy odor, the role of sweat. An earthy or musky vaginal odor is often linked to sweat. The groin area, including the vulva, houses numerous sweat glands that produce perspiration, particularly during physical activity or in warm weather. This sweat can interact with bacteria on the skin's surface, leading to a more pronounced earthy scent. While an earthy odor due to sweating is generally normal and nothing to be concerned about, excessive sweating or a strong odor might indicate a need for adjusted hygiene practices. Here are some tips to help manage odor related to sweating. Opt for cotton underwear, which allows for better airflow and helps wick away moisture, reducing the likelihood of odor-causing bacteria. Daily showers, especially after sweating, can help wash away sweat and bacteria, keeping the area clean and fresh. After showering or bathing, make sure to thoroughly dry the groin area to prevent the growth of odor-causing bacteria in a moist environment.
Section 10. Tangy odor, a sign of a healthy vagina. A slightly tangy or fermented vaginal odor is often associated with a healthy vaginal environment. This subtle tanginess is attributed to the presence of lactobacilli, the beneficial bacteria that dominate a healthy vaginal flora. Lactobacilli produce lactic acid, which contributes to the vagina's acidic pH, a crucial factor in keeping it healthy. The lactic acid produced by lactobacilli creates an environment that is inhospitable to harmful bacteria and yeast, thus protecting the vagina from infections. In this sense, a mild, tangy odor can be seen as a positive sign that the vaginal ecosystem is balanced and functioning as it should. However, it's crucial to differentiate between a mild, slightly tangy scent and a strong foul odor, even if it has a tangy undertone. The latter is not considered normal and could indicate an infection. Always err on the side of caution and consult a healthcare professional if you experience any unusual or concerning changes in your vaginal odor.
Section 11. Bleachy, odor, urine leakage, and infections. A bleachy or ammonia-like vaginal odor can be a sign of urine leakage, a common issue that involves the involuntary release of urine. This leakage can occur for various reasons, including the pelvic floor muscles support the bladder and urethra. Weakening of these muscles, often due to childbirth or aging, can lead to urine leakage, especially during activities like coughing, sneezing, or exercising. UTIs occur when bacteria enter the urinary tract, causing inflammation and infection. The ammonia-like smell of urine can become more noticeable if you have a UTI. Some medical conditions, such as diabetes or neurological disorders, can also contribute to urine leakage. If you experience a persistent bleachy odor, consult a healthcare professional to determine the underlying cause. They can assess your symptoms, perform a physical exam, and potentially recommend tests like a urinalysis to check for UTIs or other conditions. Treatment for a bleachy vaginal odor will depend on the underlying cause.